The role of PI3 kinase inhibitors in the management of CLL is becoming clearer. We frankly have great new therapies, frontline therapies for patients with CLL, whether that be one of the BTK inhibitors or now venetoclax in combination. And so I think many physicians treating patients with chronic lymphocytic leukemia would likely start with ibrutinib or venetoclax, and if they haven't had that when someone progresses, perhaps switch to the other agent. But we have a real need for patients who've had at least 2 prior therapies in CLL. And I think this is where the PI3 kinase inhibitors come in, specifically idelalisib and duvelisib in this patient population. That's the group that I think probably has the biggest need and where the efficacy is best. And frankly, the toxicity, the adverse event profile supports using these agents in that setting. Now, the question comes up whether you use the single agent duvelisib or you use a combination of idelalisib and rituximab in that setting. And I think it's really an unknown question, to be honest with you. I think either is an appropriate approach. We do know that duvelisib as a single agent is oral, and it's certainly easier for patients than combining with rituximab. But you could also ask the question does rituximab really add anything to idelalisib? And so some investigators might say, and some clinicians might say, well, maybe just use single agent idelalisib. But regardless, I think this is the patient population who've had 2 prior therapies that are really where the PI3K kinase inhibitors are of most use. In chronic lymphocytic leukemia, duvelisib has been approved for patients with 2 prior therapies with CLL. This is based on the DUO trial. And the DUO trial was a large randomized international phase 3 trial where patients were randomized to receive patients with 1 prior therapy randomized to receive either duvelisib or ofatumumab. In a subset analysis with patients with 2 prior therapy, the duvelisib improved response rates, nearly doubled the overall response rate, and compared to single agent ofatumumab, and substantially improved progression-free survival from a little bit over 16 months to approximately 9 months in that subset of patients, and also had an improved safety profile when used for patients with 2 prior therapies. So a very important addition to our armamentarium for patients with chronic lymphocytic leukemia. In a similar fashion, idelalisib was also tested in a large randomized international trial. Here the design was for patients with at least 1 prior therapy and who are basically unfit for more aggressive treatment. Patients were randomized to receive either single agent rituximab or the combination with rituximab and idelalisib. In a recent update to our initial publication, we've seen that there's progression-free survival is now in advance of 20 months for patients treated with a combination of idelalisib and rituximab.